Welcome to the Coronavirus Weekly Brief. We're your hosts. I'm David Sterman.
And I'm Emily Schneider. Here are the headlines you need to know.
The 7-day average for daily U.S. vaccinations dropped to 1.98 million as of Saturday, the first time it's fallen below 2 million since early March. Some states are turning down their federally allotted vaccine doses in response to flagging demand. Wisconsin, for example, accepted just 8% of its available doses for next week. Over a third of the population is fully vaccinated, but the goal of herd immunity, for which 70 to 85% of the U.S. population will likely need to be vaccinated, is looking improbable. Centers for Disease Control and Prevention Director Rochelle Walensky said the government anticipated supply exceeding demand. Quote, "We knew that we would have a lot of supply by the end of April, early May, but we also knew that this would be the time when we had people who were more hesitant, that people wouldn't be rushing to be getting a vaccine," end quote.
The Biden administration is aiming for 70% of the adult population to have at least one dose by July 4th. To ramp up vaccination rates, health experts say the government needs to make the shot as convenient as possible, something the Biden administration is working toward by shifting its vaccination campaign to a local level. Health experts say the White House should incentivize the shot by aggressively relaxing public health guidance for vaccinated people. Some experts worry that pockets of the country with lower vaccination rates will suffer variant-driven COVID-19 outbreaks in the coming weeks.
Several COVID-19 vaccines, including 2 approved for emergency use in the United States, are effective against more contagious viral variants, as reported by a spate of studies published Wednesday. The 2-dose Pfizer vaccine appears to offer significant protection against the B.1.1.7 UK variant, now dominant in the US, and the B.1.351 variant believed to have emerged in South Africa. One study published in the New England Journal of Medicine and based on recent health data on over 200,000 people from Qatar found the Pfizer shot to be 87 to 89.5% effective at preventing the B.1.1.7 infection and 72.1 through 75% effective at preventing B.1.351 infection among fully vaccinated people. While these figures, particularly those for the South African variant, do represent a drop compared to the protection Pfizer offers against earlier coronavirus strains, one of the study's authors said the results are still promising. Quote, "We're talking about a variant which is probably the nastiest of all the variants of concern," said Laith Abu Radad, an infectious disease epidemiologist at Weill Cornell Medicine, Qatar.
The researchers also reported nearly 100% protection against severe illness or death caused by any strain of the virus. Another study conducted by Pfizer and the Israel Ministry of Health, published in the medical journal The Lancet, looked at over 230,000 COVID-19 infections in Israel between late January and early April of this year. The researchers found the Pfizer shot to be 95% effective at preventing COVID-19 infection, hospitalization, and death during a time when the B.1.1.7 variant was causing almost all of the country's infections. Moderna also published data on its vaccine and coronavirus variants, investigating the effects of a B.1.351 specific booster shot administered to 40 already fully vaccinated patients. Before this half-dose booster shot, most of the patients had antibodies from the initial 2-dose regimen in their blood, but about half had little protection against the B.1.351 and P.1 variants. After the booster, the patient's antibodies against these strains increased. Lastly, American company Novavax released a study showing its shot to be 60% effective in HIV-negative adults in South Africa, home of B.1.351 variant.
Pfizer and its partner BioNTech announced last Thursday that they will donate vaccines to competitors and staff at the Tokyo Games. In a statement, the pharmaceutical company said that they had signed a memorandum of understanding with the International Olympic Committee outlining the delivery of initial vaccine doses, quote, "expected to begin at the end of May where possible, with the aim to ensure participating delegations receive second doses ahead of arrivals in Tokyo," unquote. As of now, the Olympics are scheduled to start July 23rd, but there are persistent concerns about Japan's readiness to host the Games and the risk of an outbreak among athletes and staff. Japan had issued a state of emergency to contain a 4th wave of the outbreak, but last Wednesday, officials in Tokyo asked the central government to extend that state of emergency until May 31st. Just a week ago, on April 29, Japan recorded its largest number of daily infections since the start of the pandemic.
Last week, Canada authorized the use of the Pfizer-BioNTech vaccine for children ages 12 through 15. The two-dose vaccine is the first allowed for use in that age group by the country's drug regulator, Health Canada. Supriya Sharma, Chief Medical Advisor for Health Canada, said the agency reviewed the data from a Pfizer study in the United States that involved more than 2,200 adolescents aged 12 to 15. Half received the two-dose regimen administered to adults. The others were given a placebo. The study found the vaccine was 100% effective in preventing infection among participants who received the two doses. There were 18 cases of COVID-19 among those who received a placebo. The participants given the vaccine produced strong antibody responses similar to those observed in young adults aged 16 to 25. According to Sharma, people younger than 19 account for about 20% of Canada's coronavirus cases, although they are less likely to experience severe illness.
In an effort to boost New York City tourism, Mayor Bill de Blasio announced the city will set up mobile vaccination clinics at major sites like the Empire State Building and Central Park, offering visitors a free Johnson & Johnson shot. Tourism of New York City took a hit during the pandemic. The city's tourism agency, NYC & Company, estimated the number of visitors coming into New York City won't bounce back from the pandemic for another 3 years. New York State has residency requirements in place for COVID-19 vaccination, but de Blasio's plan to deploy vaccine vans to tourist hotspots gained state approval.
To see our daily brief, go to the address in our show notes and follow us on Twitter @NewAmericaISP. The Coronavirus Weekly Brief was produced by Shannon Lynch and Jason Stewart and was edited by Shannon Lynch. This podcast is brought to you by New America and Arizona State University.